Joshua was very outgoing. He loved to fish. A student could be having a bad day and Joshua could come through the door with his smile and just change their whole day. He loved helping people. There was an autistic child that he was making sure made it to the middle school because they had to walk. And he made sure that they made it to school safely. He wasn't one to do something and then brag about it. He was doing it just out of the goodness of his heart. I get a phone call from my daughter telling me that Joshua had been hit on his bike. Joshua has rode his bike for years and crossed the road so many times, and he didn't make it across the road. We get to the hospital, we walk in, somebody finally, they come out to get us, and we're thinking, okay, we're going back to see Joshua. Instead, they put us in a room to tell us that he didn't make it. How could this have happened? How can it be prevented to happen to somebody else to have to go through it? And I contacted FDOT.
I handled a call from a woman whose son had been killed within a few days before. And, well, first of all, it's devastating to learn that. There are many, many factors that go into making a plan for a safety project on a state road. So I talked to my supervisor, and he sort of passed the idea along to Kevin, who was in our office at the time, doing different things.
We were able to develop a scope of studies to start investigating what could be done at that site to improve conditions and hopefully prevent another fatal crash. The study recommended that 2 new crosswalks be installed on the US 192 corridor.
This project met all the criteria, so we got the federal safety dollars.
Both crosswalks are providing a brand new controlled crossing opportunity for pedestrians, and we also are able to improve conditions at existing signalized locations by introducing new controls to promote the yielding compliance of cars towards pedestrians that are using those crosswalks.
We are putting our cuts in Indiana and Florida Avenue that will give the opportunity for pedestrian traffic to have good, solid crossings within that area.
I reached out to Kevin Marquez. He provided me with Celeste's information. I actually reached out to her towards the beginning of the project and number one, introduced myself as the project manager. But number two, I personally invited her to the public meeting because I wanted her to be involved.
After meeting Celeste, I felt like we needed to do everything that we could do in order to make it a safer place to walk and bike out there. So we immediately began an intensive public outreach process, and we did outreach events. We worked with the city, with the police department, with the schools, and Joshua's mom, Celeste, was present at every single event that we had.
We've done a lot of outreach with the local schools. We've fitted kids for bike helmets. We've taught them how to be safe as a transportation user. We've worked with law enforcement. We've worked with the crossing guards. It's really a great example of all of these different efforts can come together and complement each other. With Joshua's tragedy and his death, he is going to be saving lives in this community, and that's something to be proud of.